Vitamed, a leader in non-invasive neuromonitoring. Vitamed has made the complex simple. It has taken two hard-to-measure neurological parameters, cerebral compliance and cerebral autoregulation, and created revolutionary non-invasive monitoring devices capable of producing continuous real-time results. Today, clinicians only have a partial picture of the vascular changes going on inside the head, meaning patient care can be suboptimal. Cerebral compliance and autoregulation offer clinicians new ways to detect and prevent insults to the injured brain by complementing current monitoring approaches. Although both parameters can be measured today, current solutions are invasive and difficult to interpret, meaning few patients are monitored. Vitamed's patented monitors solve these difficulties non-invasively. Simply by measuring the time an ultrasound pulse takes to cross the head, Vitamed's monitors can detect subtle changes in the pulse, respiratory and fluid waves inside the head, allowing calculation of both cerebral compliance and autoregulation. In a healthy brain, small arteries expand and contract automatically to compensate for rises and falls in intracranial pressure due to breathing or changes in blood pressure. This phenomenon, known as autoregulation, plays a vital role in protecting the cerebral vasculature. If autoregulation becomes impaired, the brain can no longer compensate for changes in blood pressure, putting patients at risk of cerebral ischemia or hemorrhage. Specifically for traumatic brain injury, a number of clinical studies have shown that impairment of cerebral autoregulation is associated with a worse clinical outcome, and that loss of autoregulation may be an early sign of rising intracranial pressure. Indeed, a recent consensus paper from the European Society for Intensive Care Medicine highlighted the value of adjusting treatment targets for patients with traumatic brain injury based on the state of their cerebral autoregulation. Yet, despite the increasing recognition of the value of autoregulation monitoring, current techniques are complicated and require invasive probes, meaning many patients who might benefit don't receive it. In response, Vitamed has developed the world's first clinically proven non-invasive cerebral autoregulation monitor, the Vitamed 505. The Vitamed 505 provides continuous real-time data for routine clinical care, helping clinicians detect and respond to changes in cerebral autoregulation. The device consists of a portable monitoring unit and a disposable head frame designed to be easily fitted with minimal training to a patient. Once a good signal is obtained, the device gathers data for 3 minutes before displaying a continuously updated trace. As with the cerebral compliance monitor, the Vitamed 505 measures the time of flight of an ultrasound pulse across the head. Using this data, it generates a continuous measure of autoregulation, the pressure reactivity index, or PRX. PRX measures the relationship between intracranial pressure and arterial blood pressure. Normal cerebral autoregulation produces a negative PRX. In other words, cerebral arterioles constrict with increasing blood pressure, while a positive PRX indicates non-reacting cerebral vessels and impaired autoregulation. Importantly, the Vitamed 505 has been shown to be clinically accurate. A study monitoring 13 patients with traumatic brain injury for a total of 87 hours found no statistically significant difference between the Vitamed 505's results and those produced using results calculated from invasive ICP and arterial probes. Accurate, simpler and safer autoregulation monitoring has the potential to change clinical care, helping clinicians provide better tailored treatments for patients with traumatic brain injury and other vulnerable patients. The Vitamed 505 is part of this solution. Vitamed, developing the next generation of neuromonitors.